higher number is when the heart is pumping. The lower number, the diastolic, is when the heart is relaxed. And each of them has its own importance. So when someone checks your blood pressure, the high number, we want it to ideally be below 120. But hypertension is defined if the number is above 140. And the lower number, when the heart is relaxed, ideally below 80, but hypertensive is when the number is above 90. However, in that gap of between 120 to 180, and for the top number in 80 to 90, a lot of things could happen. A lot of the bad outcomes of high blood pressure could happen that I'm going to go over with. In the US, about a third of adults are hypertensive, meaning the blood pressure is more than 140 over 90. So it's about 76 million Americans, give or take. In the African American community, it's about 44%, especially about 48% of African American females have high blood pressure, which is very dramatic. And the number, unfortunately, is going up. So we really need to do something about it. The risks associated with hypertension, with elevated blood pressure, the first risk is if you think that there's high blood pressure running or high pressure running in a hose, there's a risk of rupture. So the rupture could happen in the brain, that's an aneurysm, could happen in our stomach, that's an aortic aneurysm that a lot of, you hear it in the news commonly, John Ritter died from an aortic aneurysm. It could cause heart attack, it could cause blindness, it could cause kidney disease. And so we really need to do something about it. What are the risk factors? Why is there so much hypertension? The number one risk factor that fortunately is going down is smoking. Smoking nicotine in general is a huge cause of hypertension. High cholesterol, because the arteries start thickening and cause the blood pressure to go up. Diabetes, which again, because of our weights are going up, there's a lot of diabetes, like I told you, abdominal fat can cause the blood pressure to go up. Also, men age 55, the risk of high blood pressure goes up. For women age 65, that's when the hormone starts going down. Family history of premature heart attack, meaning under the age of 50, and kidney disease, which again is unfortunately on the rise. About 90 to 95% of the elevated blood pressure is from something that we can control. It's a interaction between genes and environment. So obesity, smoking, diabetes, all of those are some things that if controlled, even if we have the genes, we can control it. About 5% is from other causes, from kidney disease that's not in our control, from side effects of some other medications, caffeine, licorice. If you eat a lot of licorice, blood pressure will shoot up. Sleep apnea, that is something that is very underdiagnosed, but there's a lot of awareness with it, with sleep tests. But if there's uncontrolled sleep apnea, blood pressure can go up. What are the symptoms of hypertension? Unfortunately, hypertension, there's no symptoms in the majority of the cases. Our blood pressures could be running high and we could be completely asymptomatic. Usually when someone comes to us doctors with symptoms, that means the blood pressure has been high for a long time. And those symptoms are fatigue, shortness of breath, difficulty when they lay down, blood pressure goes up, they get a headache, they get very groggy, pounding in the chest, blood in the urine, and other chronic symptoms. And when someone comes to me with really high blood pressure, like 180, 190, 200, with those symptoms, I usually have to send them to an emergency room because they need immediate action. But with lower ones, then we start a workup. We start echocardiogram, we get an EKG, we do blood work to make sure it's nothing that can be reversed and treated before I start them on medication. And my philosophy is if it's something that can be done without medications, I always tend to go with the preventative measure, and that's why we're here. I know you guys are itching to walk, so I don't want to take too much of your time. Next time I'll talk about exercise and treatment of hypertension.
Yay.